Okay, here's the third part of chapter 13, and these are spinal nerves. So also very interesting. You might have trouble with these sometime in your life, or you might already be having trouble. So there's 31 pairs of spinal nerves. They come off your vertebral column. They're divided up based on your vertebrae. So you have 8 pairs of cervical nerves, 12 pairs of thoracic nerves, 5 pairs of lumbar, 5 pairs of sacral, and 1 pair of coccygeal nerves in your coccyx. Okay, so the cervical vertebrae, you've got the 8 pairs. The first 7, they're named for the vertebrae. And then the last, the 8th nerve, comes out of the canal that's just under the 7th vertebrae. Okay, so let's see, here they are. Here's your cervical nerves, and then your thoracic nerves all the way down here, and then your lumbar, and you can see they kind of get thicker as you go down, and then your sacral nerves, and then you have your coccygeal nerve. And this cauda equina means horsetail, and you can see it kind of broadens and looks like a horsetail. Okay, each nerve is connected to the spinal cord with 2 roots. You have ventral roots and dorsal roots. The ventral roots are the motor, the efferent fibers. The dorsal roots are the sensory afferent fibers. And they branch as little rootlets, and then they join the whole nerve, the spinal nerve cord. So these are the little rootlets right here, and you've got your dorsal and ventral. So let's see, this one's dorsal here, and this one's ventral. You can see the different places where they combine. Okay, so the spinal nerves come out, on the vertebral column, how it's weird shaped. They come out of their intervertebral foramina, which we learned about earlier. And they get longer as they go down, and then eventually it forms that larger area chunk called the cauda equina. So spinal nerves are short, 1 to 2 centimeters. They are divided into 3 branches: the dorsal ramus, ventral ramus, and meningeal branch. And that's a typo. The ramus communicate, oh no, maybe it's not communicantes, sorry, contain autonomic nerve fibers that join ventral, rami, and thoracic region. Okay, so here's the spinal nerve. You can see your nerve roots right here hooking into the spinal cord, and then they're going to branch out into your ventral ramus here. Sorry, your ventral ramus is here, your dorsal ramus. And then like this one, for example, wraps around here. So this is called the intercostal nerve. Okay, different body regions are going to have nerves connected to them. So all these nerves as you go down the back are going to be connected to different parts of the body. The dorsal rami supply the posterior body trunk, and then the ventral is the rest of the body trunk. So all ventral rami except for T2 to T12 make these nerve plexuses. So those are in the cervical, brachial, lumbar, and sacral areas, but not in those thoracic areas. They go out to the periphery body, out to your limbs, your muscles. Each limb is innervated by more than 1 spinal nerve. So if you have damage to 1 spinal nerve, there's still a chance that you're going to have nerve function, at least partial nerve function, because other nerves are connected there. Okay, so cervical plexus and neck, the first 4 ventral rami are C1 to C4. This innervates the skin of the neck, ear, and back of head and shoulders. And then phrenic nerve gives you motor and sensory nerve of the diaphragm for breathing, and that's nerves C3 to C5. So here they are showing the hypoglossal here, cranial nerve 12, and then here's your accessory nerve 11. So we learned about those last time. And then these are your other cervical nerves that go out to different places that we just saw. So here's where they innervate, either sensory or motor. Irritation of the phrenic nerve can cause hiccups, That's what causes your diaphragm to spasm, and then you get hiccups. If the phrenic nerve is severed, your diaphragm would become paralyzed and you wouldn't be able to breathe. So you would need a mechanical respirator. Okay, brachial plexus and upper limb. This is C5 to C8 and T1. Sometimes C4 or T2. So these innervate your upper limb. There's 4 major branches. You have the roots, trunks, divisions, and cords. So here's C5 to T1 going down into your arm. And you've got the yellow is anterior divisions and the green is posterior divisions. And then the trunks like branch out, right? So here's where where their roots are, and then where in the trunk they branch out to, and where the cords are, and where the terminal branches are. Okay, so the axillary cord innervates your deltoid teres minor, skin, and joint capsule of shoulder. Musculocutaneous cord innervates your biceps brachii, brachialis, coracobrachialis, and the lateral forearm. And then your median cord innervates flexors, forearm pronators, wrist and finger flexors, and thumb opposition muscles for thumb wars. Then you have a brachial plexus and, oh, this is still the same, sorry. So your ulnar cord supplies your flexor carpi ulnaris, and then part of your flexor digitorum profundus, and your hand muscles and skin, and then your radial cord innervates your extensor muscles, supinators, and skin of the lip. So this is where they travel through. It is not a common injury or issue is your ulnar nerve right here, because this bone kind of cuts in on it. And so if you have like swelling of the elbow or issues like that, it'll cause your hand and pinky to go numb all the way down your hand. So that's what's going on. If you have any symptoms like that, just look at where these nerves are and you can maybe tell what's going on. And there they are in another picture. And then there's a nice list of the brachial plexus. Pretty complicated. Yeah, and you can have injuries that can cause weakening or paralysis. Injury to the median nerve, you can't do a pincer grasp. Carpal tunnel is when the median nerve is compressed. And then ulnar nerve, like I said, is vulnerable to issues too. Okay. Trauma to the radial nerve can cause wrist drop. Saturday night paralysis, when a person falls asleep and they cut off blood supply to the radial nerve. So you can have all kinds of problems with these. Okay. Where are we? Lumbosacral plexus and lower limb. So there's some overlap, which is good, because if there's damage to one nerve, you still have feeling and motor control. Okay, so lumbosacral plexus serves mostly lower limb, also parts of the abdomen, pelvis, and buttocks. So L1 to L4 innervates the thigh, abdominal wall, and psoas muscle, quadriceps and skin of anterior thigh and medial surface of leg, and then obturator nerve passes through obturator foramen to innervate the adductor muscles. Okay, so here's L1, 2, 3, 4, and then I think we'll have another picture that shows where they go. Yep, here they are. So you can see, just follow them down and see where they, what they innervate. Okay. And then sacral plexus is from L4 to S4, serves the buttocks, lower limb, pelvic structures, and perineum. It is the longest, the sciatic nerve is part of this, and that is the longest, thickest nerve of the body. People often have trouble with their sciatic nerve. Innervates hamstrings, adductor magnus, and muscles, most muscles in your leg and foot. So right here, these two, that's your sciatic, and a lot of people have problems with that nerve. And right here it is. There's two parts to it, and it travels all the way down. Right here it is. Okay, so I'll read through that. There's the rest of them. Okay, so summary of the major plexuses, your cervical, brachial, lumbar, and sacral. Those are the four that we looked at. You can have spinal roots compressed, and then you'll have trouble walking. Might be motor, and it might be sensory issues. Sciatica is a really common problem, stabbing pain. It could be because you have a disc herniation and could be putting pressure on the nerve. And there's also foot drop, where you're not able to keep your foot flexed when you walk. Okay, let's see, where are we? Anterolateral thorax and abdominal wall. So this is, I think this is a typo. I think it's supposed to be T1 to T12, your intercostal nerves. We'll see on the picture. Okay, so let's look at what's next. So the back is innervated by dorsal rami and with several branches. Each branch innervates some muscle and skin right where it comes out of the spinal cord. Dermatomes are areas of skin that are just innervated by a single spinal nerve. And there's some overlap, so once again, if one nerve gets damaged, it may not wipe out the whole area. So these are your dermatomes. This is where those nerves feel cutaneous areas, and which is kind of nice because if you do have damage to like T1, then you might be able to kind of tell like for sure that it's T1 based on that. So, okay, innervation of joints. Your joints also have nerves. And Hilton's law is that any nerve serving a muscle that produces movement at a joint also innervates the joint and skin over that joint. So if that joint is innervated, so is the skin around it. And that's it.